For over 100 years, employers in every state have been required to provide workers' compensation coverage for their employees. The intent of workers' compensation is to provide for medical care and wage replacement benefits to a worker who is injured or becomes ill as a result of their employment, but in effect, it is a legal system benefit with medical coverage. Depending on the severity of the injury or illness, these benefits can go on for weeks, months, even years until the employee can return to their regular job or, in more extreme cases, is determined to be disabled or succumbs to that injury or illness. When an injury or illness does occur, it requires coordination between the employee, the employer, the workers' compensation benefits coordinator, an insurance carrier or claims administrator, and most importantly, the medical provider. Unless there is an issue with the injury or illness being covered by workers' comp, the treating physician is required to send their billing for services to the employer or their workers' compensation benefits coordinator or insurance carrier or claims administrator coverage insurance provider. But since workers' compensation coverage was enacted on a state-by-state basis, and that it is really a legal process, getting paid for treating a workers' compensation patient can be somewhat cumbersome. The first hurdle for the medical provider is knowing who the employer or workers' compensation benefits payer is, which can sometimes be an issue. And it's not only sending a traditional medical billing form for the services rendered, there's one more major effort required. Caregivers are required to send supporting documentation with the billing, such as treatment notes, a state form, or other material. This information is used not only to determine if the care is appropriate for the injury or illness, but may also be used in the determination of the need for ongoing disability benefits or limitations when the employee is ready to return to work. Until fairly recently, the only way to send billing was on paper, and the results were often very discouraging. From finding the correct payer to supplying all of the necessary information needed to process the bill for payment, it sometimes took multiple tries and possibly several months to get paid, if you could get paid at all. About the year 2000, workers' compensation payers and providers began to explore sending this information electronically. In the larger group health market, electronic billing between providers and payers was commonplace. However, the challenge again was the documentation. The early results were very encouraging. Payments were flowing faster, claims were being handled better, and there was less friction between stakeholders. Unfortunately, the readiness state of technology for both providers and payers was just not there yet. Although in limited use, by the mid-2000s, state regulators took notice of those early digital transaction results and decided that it was imperative that the industry must eliminate the reliance on paper. So discussions began in a number of states to enact rules to mandate providers and payers to work together electronically, starting with Texas. Several questions arose. In reality, a medical provider may treat injured employees from multiple employers, each with their own workers' compensation programs. And likewise, a workers' compensation payer may work with hundreds or even thousands of providers. How is this going to be feasible? One firm, Jopari Solutions, had already been working with workers' compensation providers and payers for many years, helping to streamline payment flows. And it was many of those same customers who asked Jopari to help them meet these new requirements. The Jopari team analyzed the need of both the providers and payers, quickly developing tools and a connectivity network to link everyone together that could effectively handle billing and the documentation electronically. It allowed medical providers and payers to use their existing technology, thus preventing the need to invest in additional systems in order to benefit from this connectivity. Jopari quickly rose to assume a leadership role within the industry, to develop and ensure that a consistent set of rules were being established nationwide, and to incorporate the current transaction standards already being used by many medical providers to manage billions of payer interactions. Today, Jopari has the most extensive network of connectivity in the industry through partnerships with states, standards organizations, technology solutions, and other stakeholders. The ability to electronically deliver both medical billing and documentation is now readily available, and it's making a difference. Providers are seeing less hassle with the billing process, receiving payments quicker, and focusing on patient care instead of administrative runarounds. Payers are experiencing faster delivery of medical information, which can help them improve decision-making in the claims process, cleaner data, and better use of staff instead of handling reams of paper or being on the phone answering inquiry calls. Join Jopari's network of over 4,000 payers and 850,000 providers, working together to eliminate the pain and the cost of paper. For more information, contact Jopari Solutions